Hi Joel.
Kman.
Yeah, Logan.
Pretty good.
Yeah, mate. Welcome team. We're here at the Max College with my soccer ball. Why do I have a soccer ball? Because we play soccer. No, we're here because we're going to talk about blood pressure. Yes, now soccer can raise your blood pressure at times, depending who you're going for, right? You follow soccer?
I do.
You do? Really? Who do you follow?
I follow my hometown team. It's called Alaves.
Alaves?
Yeah.
Where's that?
Where is it?
Yeah.
It's in
Sounds foreign.
It is. Yeah. I don't want to get too into it.
Okay. What country?
Spain.
Spain. Oh, they're famous for soccer.
Yeah.
Yes. Do they find your soccer team raises your blood pressure sometimes? Yeah. It is. So that's what we're talking about, blood pressure. And we all sort of know what it is. We know it's something to do with coronary heart disease or indication of coronary heart disease or coronary health. So I want to explain in simple terms for Aitor and Logan and the millions of people at home. Yeah. Millions, Logan. I'm watching you right this minute. People will know a little bit more about blood pressure. So let me have a look at the best way I can explain it. If you had a balloon or a soccer ball, because we play soccer, you like this handy? A bit of a basketball too. This soccer ball, whether it be a balloon or a soccer ball, has a pressure in it. Now, you play soccer?
Yep.
So when you pump the soccer ball up, you pump it up to a pressure which you know is about optimal. Would that be correct? You sort of know if you pumped it up too much, and you sort of know if it's not pumped up enough. So you pump it up to what you call the optimal pressure for a soccer ball, or football for that matter. If we were going to have a birthday party and we're going to blow up balloons, and the three of us blew up a whole bunch of balloons, without really sort of working together, we'd blow up the balloons and tie them up, and you'd probably find that the balloons would be around about the same size. Would that be right? Because when you're blowing it up, you're going, okay, that's not enough. So you keep blowing it up, and you sort of know if I keep going, that's probably too far, where it's going to pop. So you sort of sense what's the optimal pressure to blow up a balloon is, then you tie it up and get it ready for the birthday party. So I want you to think of the optimal pressure in a football, because there's only one type of football, isn't it? That's the round one. Or the optimal pressure in a balloon is the optimal blood pressure in the vascular system. So the vascular system is like a soccer ball, right? So treat that as the vascular system, because the vascular system, which is your heart and all the blood vessels, it goes out with the arteries, come back by the veins. It's a closed system, unless you get a knife and you're hemorrhaging, right? In the femoral artery, as one of my samurai slicers would do. It's in a closed system. So I have a system not full up with air, but filled up with blood. And because it's filled up, there's a constant pressure of the blood up against the vascular wall of the arteries or the veins, as there is a air pressure pushing up against the football, basketball, rugby ball or balloon. That's what you'd call your optimal pressure. Now, the optimal pressure in the body, there's two pressures. Here there's only one pressure, right? Because you blow it up and that's it, because it doesn't move. It's just the pressure doesn't change until you kick it. So when you kick it, increases the pressure in the ball. Would that be right?
Yep.
Increase the pressure, it goes off. Well, we have our own kick in our body. It's called the heartbeat. Boom, 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 boom. I've got a rhythmical heartbeat. No, it goes boom. So basically what happens, imagine this is the vascular system. And when your heart contracts, it's like a part of the ball contracting. Heart contracts. So when the heart contracts, it pushes blood out of the aorta, the arteries, all the way down through the vascular system and back via the arteries. So when the heart contracts, if I did this to the ball, what would happen to the pressure in the ball?
It'll change.
It'll go up or down?
Yeah.
It'll go up.
Yeah.
So when the heart contracts, to push blood through, contracts, relax. Contracts, relax. Contracts, relax. Contracts, relax. Contracts. Am I annoying you? Yes, you're not. Okay. I thought I went on a bit too fast. So when the heart contracts, what happens to the pressure? It goes up. When the heart relaxes, the pressure goes down. As in the balloon, if I pressure, contract, relax, the pressure in the balloon goes up. The pressure when I relax, the pressure in the balloon goes down. So when the heart contracts and the pressure goes up, all the pressure through all the vascular system, because blood's being pushed through and the heart's contracting, the overall pressure goes up. So at rest, it will go up to what we call your systolic blood pressure. Systolic. We call it systolic. We call the easy way to differentiate. S is superior, means one on top. So the first one is the one on top, systolic. And that, a normal pressure, as the normal pressure for a soccer ball, or normal pressure for the size of the balloon, is 120. 120. And that means nothing to you. But what it represents is 120 mmHg, which is milligrams of mercury. Because in the old days, before we used the little calipers and the electronic ones, we'd have a little, what we call a sphygmometer, which is there, and you pump it up and mercury would go up a tube. And there'd be 120, which is 120 millimeters of mercury going up the tube. So 120 would be optimal vascular blood pressure when the heart contracts. When the heart relaxes, is there still pressure in the ball? Yes. Still pressure, but it's less pressure. That's what we call your diastolic blood pressure. So that's when the heart relaxes. There's still pressure in the enclosed system, but it's lower than when the heart contracts, and that's called your diastolic blood pressure. And that measurement for a normal ball, a normal balloon, a normal vascular system is a measurement of 80. So normal blood pressure for the ball, for the balloon, for the vascular system is 120 over 80. There's two numbers because the pressure will go up and down. So it's up normal, down normal. When the ball is just one, or balloon's just floating around there full of helium, it's just one pressure. But you sort of know that's optimal. If you see it's really small and spudgy, softy, then that's not enough. That's low blood pressure. If it's too high or it's really pressuring, that's high blood pressure. So there's a nice simple explanation for you to understand what's normal and what the systolic and diastolic, and it's probably a good way, a good tool to use to explain to your clients. So how do we measure it? How do we measure it? Well, we use what we call, we'll talk more about high and low blood pressure soon, but let's just focus on the normal blood pressure. You look like two normal guys, right? Normal's good in this instance. You want to be unique because you've got high blood pressure or low blood pressure. So what we use is we start to play doctor. Right? I get my stethoscope, and if I want to do your blood pressure, right, and if you're a good-looking sort, so take your clothes off, put them in the corner on top of mine, and we can get started. But because you're not, we'll keep your clothes on.
Righty.
That sound good? Yeah. Okay, so we use what we call a sphygmometer. Please don't ask me to spell it. See that spelling there? That's a big long word, isn't it? Yeah. A sphygmometer. You say that after a couple of vinos. A sphygmometer. Okay. And we use a stethoscope. Now, basically what we're going to do here is quite simple. I'm going to put this cuff, this is called a cuff, right? Not this type of cuff, but this cuff goes over your right arm. Now, right arm, left arm, it works on both. Most cardiologists, or all cardiologists I've had this done with, they always do the right arm. No one can give me a clear explanation of why they use the right arm, but if someone does have that explanation somewhere out there in the cosmos, please let me know so I can add this to the educational process. But I've asked lots of different people, including cardiologists, and they just said we just do it to the right side. Because it just sounds right. Aren't I right? Yes. Right. Thank you, Logan. So I've got a good supporting crowd here. So what we're technically going to do is we're going to take this cuff and we're going to put it around Ayator's massive bicep, right? Now the goal is I'm going to put it around your bicep because what runs through here are your blood vessels. Blood goes down there, right? So what I'm going to do is I'm going to wrap this cuff around and I'm going to pump it up, right? And it's going to squeeze your bicep, right?
Yep.
And then what it's going to do is actually squeeze it. Now in your bicep are the blood vessels, right? Your arteries. And as it compresses your arm, it compresses your arteries. And it'll get to a point where the pressure of the cuff will close your arteries off. and you will occlude blood supply. Stop blood supply. Dun, 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 dun. Right? No blood will go to your lower limbs, your lower arm. And you feel that it's cut off. Now, obviously, you're not going to keep that for long, because otherwise you get tingly feelings and stuff like that, and tissue dying.
You don't want that.
No. So what the cuff's going to do is actually close off the blood vessels, and then when I take the pressure up to, I know it's closed. And normally I would take the pressure up to, on the cuff, to probably around about 180, 200. Right, so it's above well above normal. And then what I'm going to do is I'm going to release the valve, and the cuff will release your arm. You slowly release it, and your arteries will be closed off. But eventually, the internal pressure, the pressure of the cuff, it will be greater than the outward pressure of the blood on the artery, right? It means the pressure is greater this way, so it's going to stay shut. But eventually, as the pressure of the cuff releases, the pressure of the cuff compressing the artery will be the same as the pressure of the outer pressure of the artery, or the blood on the artery. And it'll get to a stage where the artery will just open up. Just open up. And as soon as it opens up, I'll have my stethoscope ready. It will be underneath the cuff where it's closed off, because when it's closed off, I won't be able to hear any heartbeat because it's closed off. The door's shut, and it's a soundproof door. But as the cuff releases, the door will open up, where the pressure of the blood pushing up against the arterial wall will be just at the same, if not slightly greater than the pressure of the cuff. And then I will hear, boom, boom. I'll be able to hear the heartbeat. And that, when I hear the heartbeat, that is your systolic blood pressure. That's when the pressure out is almost virtually the same as the pressure in. So that's why this works, because I can hear, as soon as I hear the heartbeat, that's the systolic. Then as I keep releasing the pressure on the cuff, I'll hear the heartbeat. It will go boom, 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 or something like that. Boom, boom. Depends what you're into, blues, jazz, boom, boom. And eventually the heartbeat will disappear. And when the heartbeat disappears, that's your diastolic blood pressure. So I virtually can hear it when I first hear the heartbeat, your systolic. When the heartbeat disappears, your diastolic. Does that make sense?
Yeah.
Okay, so let's see if you've got a heart. Okay, time for Kman to play doctor. You can be my nurse. Scalpel. Okay, just bring your arm up. So what you do is you get your client, right, just to put their arm there nice and relaxed. Now it's important that you practice this, because you don't want to be fumbling around, because the client sort of, oh, geez, what's going on? It's like a surgeon fumbling with their scalpels. Going, oh, geez. Okay, so from here, stethoscope around the neck. Some of these will have little arrows where to put them. You put them just on the bicep. You don't want to be compressing the joint, you want to compress the muscle tissue, because that's where the arteries is, and it's easy to compress. So I always say these are like two veins coming out, and I put this firmly around this ginormous soccer arm of Viator's. Fantastic, so that's nice and firm. And then what I would do is I'll position, this has a little clip on it, so I can put this at the top if I want. I haven't got my glasses, but I can see enough. Of Viator. I close off the valve, so I close it off, so air will go up in there, but it won't come out. And when I want to bring it off, I just control the valve with these two fingers. So that's closed off, and I slowly release it, and I let the pressure off. So what I'll do is I'll pump this up to about 180, 200, and then I'll release the valve and just bring the pressure down. And as it comes down slowly, the calibration and the needle will slowly come down from 200 to 190 to 180. And as it gets closely around to that range, which I think his blood pressure is going to be around, I'll make sure it's nice and slow, so I don't skip past the blood pressure. Sometimes if I go too fast, I hear it when it's actually past the beat, so I don't get it accurate. And I don't do it too slow, because what happens is your fingers turn blue and things will start falling off. Right. So the valve is all nicely tightened up. Put this into my ear so I can hear, so you won't be able to talk to me. All right, make sure it's working. Oh, it is. Okay, so now I'll place the stethoscope just on the bicep underneath the cuff. I make sure it's closed off. I'm now pumping it up, as you can see, Logan. And I'm taking it to around about 180, and I slowly bring it down until I can hear a heartbeat. So it's down to 170, down to 160. I'm slowing it down now, 150. Yeah, 130. Oh, there it is. We're about 128 it popped in. Got a faster heart rate, you must be very excited.
I am, Kman.
Okay, so it's coming down to around about 128 from about 88. So once it's done, once you've got the reading, make sure you take it off straight away to let the blood ooze back into your arm. Get the fingers moving. So what is normal blood pressure? Is 120 over 80. Your blood pressure is 128 over 88. So you have around about a 10 range above and below, which is all good, right? 10 above and below. If you find that someone's blood pressure is, say, 20 above or below, so say it's 140, that's where there's a little red light sort of goes, okay, best we look a bit closer into this. So that is what we call borderline hypertension. So borderline hypertension, but understanding, us as fitness professionals, we cannot diagnose blood pressure, high blood pressure. We can't say you've got high blood pressure. That is a physician's position. But we just use this as an indicator of when to refer possibly to get a medical checkup or when not to, because we're not experts on this, but it's just a nice tool for us to use just to know, particularly with this day and age of disease and high blood pressure and coronary heart disease and diabetes. You know, I believe it's essential that we do this screening, because this is going to measure vascular health, will give us an indication if there's something going on there. So someone on 128 over 88, no challenge, there's not a challenge at all. If you're 112 down to 72, that's no challenge, so below, above. Normally 140 over 190, now you get 140 over 90, now you're getting borderline. Now, the lower, the diastolic blood pressure seems to be probably a bit more important. The reason why is, if I explain this, when the heart contracts, that's your diastolic, right? Many things can affect the contraction of a heart, right? Exercise is a big one, right? Exercise, boom, 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 goes up, right? Bit of maybe stress, bit of anxiety, oh my gosh, you know. So those things can affect the pumping. And the pumping, we just pump blood through, means that the pump's working a bit harder than what it should do. So that's important to acknowledge as high, particularly when you get up to 160, 170. That's very important to make sure you get that diagnosed. But there's many things going to affect the systolic in an acute way. Not cute and good looking, but cute in the short term, right? He thought I was saying you're cute. Oh, yeah, look at that. Yeah. It's very masculine, wasn't it? So the systolic, but it's more the diastolic. Because when your diastolic's high, it's not because it's high because the heart's contracting. It's high even when the heart's relaxing, which means what's making it high? It's not anxiety or pumping it harder to get more oxygen for exercise. Something's making it chronically high. It means it's always high because it's not contracting. Yeah. And what that could be, and it may not be, and it's not for us to determine, what that could be is maybe some blocking of the arteries, some blocking of the tubes. Because when you block a tube, like I was out early this morning, and I was hosing my puppy dog poo away. Right? So if I got dog poos and I've cleaned up most of it, but then I want to hose it, I don't just let the hose dribble out, do I? What do? I put one of those little compression things on it, so it gets a real powerful stream, just to wash the poo away, right? So what I'm doing is I'm actually decreasing the hose circumference, and so the same amount of water's going through at a smaller space, therefore more pressure. So the smaller space increases pressure. So if the pressure is increasing, and it's not increasing due to a muscle contraction or the heart contraction, it could be increasing because further down here, there's a clogging of the arteries or atherosclerosis or something happening in another artery. It might be a coronary artery. So the systolic being high, basically can give an indication of maybe some form of coronary disease. Ultimately, the systolic measures how hard the heart's working, where the diastolic measures the blood flow to the peripheral parts of the heart. So if your systolic's high, it means your heart's working harder. Right? And that could be because you're overweight, it could be because you smoke, it could be because you're exercising, it could be because you're anxious or stressed. Right? But a lot of those things can be changed pretty quickly. But if your diastolic's high, and it's not from the contraction, then it might be from a blockage, because that measures the peripheral blood flow. And if the peripheral blood flow is not very good, then it's increasing the pressure. So that's why the systolic is probably, and again, we're not cardiologists, right? I don't design little cards or cardiologists for the heart, is that it is an indication of, okay, well, and it's not that we strike fear in the eyes of our clients. Go, oh my gosh, you would not believe what the reading is. What you do, you quietly and calmly say, when's your last checkup? There's an indication that I'd like you to get this checked if you haven't had it checked recently, just to make sure that they're healthy to exercise. Or they will exercise, but there might be some conditions applied to that. Now, in my times, I've done this for many, many times, and I have sent people off to the doctor and had thank yous from the doctor saying this guy has a real genetic disorder we need to deal with, and it's a good pickup. So you can help people with this. So does that help you explain the systolic and the diastolic blood pressure?
Yeah.
Isn't it? It's great, isn't
Simple
it?
term as well.
Yeah. So high blood pressure is borderline 140/90. When you get up to more chronic high blood pressure, you're looking at now 160/110 around about. On the other hand, low blood pressure means there's not enough air in the ball, right? Or not enough air in and that many times that doesn't mean that you have to go and get a blood transfusion to get more blood into the vascular system and increase the pressure. No. That's just a genetic thing that your balloon is a little bit, it's not as pumped up. So that's a good thing compared to high blood pressure, because people don't, high blood pressure can be a sign of coronary heart disease that can lead to a myocardial infarction and heart attacks and all acute anginas rather than ugly ones. And all these other conditions that could be quite life and death type of scenario, where low blood pressure is not an indication that people don't die from low blood pressure. But what could happen with low blood pressure, which is generally a reading of anything below 100 for your systolic and 60 for your diastolic. So 100 for your systolic and 60 for your diastolic. And these are just guidelines, just to understand. So if someone's blood pressure is low, that means they probably have low pressure. And what that means is they probably don't get good peripheral blood flow. They may not get good venous return blood back to their heart, back to their mind or their brain. So they'll tend to suffer more from maybe occasional dizzy spell if they stand up. You ever got up really quickly out of bed and gone, whoa, like that? Well, that's what someone with low blood pressure experiences on a regular basis. It means when they get up, their pressure's low, therefore they don't have a good venous return. They increase in height, the drawing of the gravity, the blood pulls down, all of a sudden the brain doesn't get the blood. It's a short supply of blood, and they go, whoa, and they get a little bit dizzy. So blood pressure just shows that maybe you need to be a bit more careful when you train people, maybe when you're training as a trainer, when they get them off the ground quickly, or get them back off the bench quickly after doing some exercise, or maybe after they've done some high intensity interval work where the heart's pumping and all of a sudden they stop, and you sit them down, they're more likely to suffer from a bit of a dizzy spell. So you can get them training in bicycle helmets, so they do fall, their head's protected.
Yeah.
But I wouldn't do that because that's a bit embarrassing. But just be aware that low blood pressure doesn't necessarily lead to death, but it can lead to fainting, dizzy spells, hitting themselves, on the chair or something like that. So there's an example using a true football, not one of those funny ones, and or a balloon, and looking at how high and low blood pressure and some basic considerations, how to execute a high blood pressure measurement, but most of all to understand what you're actually doing and what's happening. So you find that a bit clear?
Yeah.
All right.
Really good.
And we've
Lots of
captured that.
sense.
Yes, we've captured it with the thousands and millions of people to view. So no pressure. Go and practice your blood pressure testing. Thanks, team.